so much.
Thank.
And so we just had two very interesting discussions on cancer. And Chavi was here. She was talking about her cancer journey. Cancer, the dreaded word that we all fear. And I would like to start this panel as well with our cancer survivor who's bringing difference and change in the lives of other cancer survivors and even people who have been diagnosed, which is I will pass on this question to you, what was it like when you got the diagnosis and how did you take charge of your cancer journey?
Thank you, Kalpana, first of all, for giving me this opportunity. And I'm grateful that you asked this question. As Chavi also mentioned that two cancer survivors or cancer patients don't have same journey, right? When I was diagnosed in 2017, it was more than a diagnosis of cancer. It was difficult for me to hide for good 22 days from my family that I was diagnosed with the cancer. Because my brother is about to get married and I don't want to ruin that happiness, which we have waited for a really long time. So I remember I used to go to hospital for PET scan, for biopsy, for every test, it's required. And same day in the night, I have to participate in all the festivals, dancing, celebrating. And then I also cut my hair so that no one would know that I was sick or I was diagnosed with the cancer.
So brave of you.
So this is how I got to know my diagnosis. And after 22 days, when my brother finally got married, I went to the hospital straight and I had my first surgery, still without knowing my family, where they install a chemo pot under my collarbone. It was a 1.5 hour surgery. And then few hours they keep me under observation. And then after that, I drove back and I break the news to my family, yes, I was diagnosed with the cancer. So it was, those 22 days actually become like a 22 years for me. And I was like, when you are dying inside and still you have to smile, you have to, laugh. And though you don't know that you're going to survive or not, what is going to happen, because I don't have an education on this particular subject. So you know how one can feel. So this is how my diagnosis happened.
And we were talking about, you should also tell the audience about your initiative where you are helping cancer patients. That would be very interesting because not many of you know, but there was a art therapy session that happened in the morning for cancer patients, and it was so inspiring, led by Anchal. So please tell us about it.
So yes, that was a beautiful session where again, thanks to Novartis for giving us this opportunity. That it's called Take Charge. So every survivor and the cancer patient, the beautiful thing is that everyone is not from Delhi or NCR, right? People travel all the way from Saharanpur, from Bareilly, and they're just being a part of that 1 hour workshop. And I run a community called Canheal community. So we see a lack in many, not a lack. I think hospital have their own way to tell people or run a support group because they have to talk about the treatment aspect as well. But in Canheal, we create a community outside the hospital, where we make them feel you are in home, you feel, you can express your emotions there. And not just this, we are trying to reduce their financial burden also by getting pathology labs and other people on board, which are the products required them throughout the journey and after the journey. And one more thing I can add in this, we talk about, success, right? What is the success or what is, we are doing for the awareness. But my take is on this. We talk about anything. We have thousands of more conventions like this or the, promotions or anything. But we are missing one point. People who just came out of a cancer, they have been rejected by the job. Some of are not even, they're thrown out of the job if they are already working. So they have to hide their biggest battle first of the thing. The second thing, they're always under the fear more than the cancer or, recurrence or anything, that if I don't have money, I'm not able to take the treatment. So I would request through this platform, I'm sure there are lots of pharma companies and lots of doctors, even the care group, there are lots of people who do this caregiving. If we can give them, because everyone don't come from a very well-off background, if we can give them a small visit charge. I'm sorry, this was not a question, but I thought if we can do that something, for them, where they can financially, little bit of independent, it will make a huge role in their life. Even the companies can create job for them, where they can, people who, see, I'll give you an example. You met the girl today, right? She was a 27-year-old girl, wheelchair bound, and Dr. Geeta also met her before, don't have any family. And 5th time she was diagnosed with the cancer. In fact, she's dealing with the last stage cancer. Her partner, who's her friend only, who's taking care of her, but she don't have financials, right? She's every time scared or have to put something on social media to raise fund for herself. But sadly, we have a problem. We don't come forward to help people till the time we don't see them dying. So she have to put, many people judge them, that, judge her, that, oh, she's doing emotional drama, oh, she's doing this, oh, she's doing that. But get into her shoes. She's scared of dying every moment.
That's a very strong statement, and we'll come back to this stigma discussion. But I would like to throw my next question to you, Dr. Shyam. With 4 decades of experience in the field of oncology, and this being the Breast Cancer Awareness Month, and the theme is Spread Awareness, Save Lives, what do you have to say, about the entire situation? How do you see it as an oncologist? Are people aware enough?
So there are several aspects of, cancer management. And I think let's first talk about early diagnosis, since you're talking about awareness. So it's very unfortunate that in a country like ours, people are not going for checkups routinely as perhaps they should be doing. And I was shocked to see the figures from our country that the women undergoing screening mammograms is less than 2%. If you were to look at US, its figure is touching about 80%. UK is touching 70% and Europe is touching 50%. So there's a huge, huge gap between what is available and what people are supposed to do, because the guidelines do suggest that after the age of 40 to 45 years, women should undergo, a mammogram at least once in 2 years. However, the government of India says that women should go to their primary healthcare workers, because you don't have the mammography machines available in small towns or, villages. So they should go to their primary health worker for a clinical breast examination once in 2 years after the age of, 40 years. So even that perhaps is not being done. So the third thing which one can do is breast self-examination. So which should be done by women after the age of 30, 40 years, every month when at the time of perhaps menstruation and so on. So, awareness is there, but there is no implementation of the recommendations from the government or from ICMR. So that's the reason why the tumors in the breast are diagnosed as cancers at late stages. The incidence of early breast cancer detection in our country is less than 30%. Majority of the women will come to us with, advanced stages of breast cancer because of so many factors. And one factor, of course, is a lack of equipment, lack of awareness, and then, of course, literacy and poverty and so on. So, therefore, there is a huge, huge gap between detecting a tumor early, because I think, as we all know, if you pick up the breast cancer at an early stage, the cure rates would be exceeding 90%. Whereas if you detect it at the 4th stage, then cures are just not possible. So there's a lot of work to be done at each level, whether it is a a government hospital, whether it is a private hospital, whether it is an NGO or as a society. So we need to encourage women to come forward to have these facilities or this awareness about breast self-examination, clinical breast examination, and screening mammograms. So I think there's a lot of work to be done, and a platform like this from Times Work can help promote this awareness that people should come around and promote early detection of breast cancer.
That's interesting. Dr. Geeta, I would like to ask you my next question, because when it comes to breast cancer, I mean, you would have seen so many patients, you know. Anchal was talking about the stigma. What is it that you notice, you've observed that, you know, why is it that women don't come forward? And I mean, I've heard so many cases that they know that, you know, those lumps in the breasts are not normal, yet they won't go for a checkup. Why do you think there is so much stigma around this?
So more than the stigma, I think it is a huge sense of denial. And, you know, it has got nothing to do with your level of education or literacy. I've seen such horrible advanced cancers in women who are IAS officers. And you keep wondering, aren't you see your breast kind of dissolve into nothing, and you come with ulcerated breast, leaking blood and pus, and you're still not kind of ready to accept that it is cancer. So denial is a huge issue that we see. Then there is the stigma, and there is this, the patriarchal nature of our society also, where women don't get a chance to express themselves. They know that they are the kind of the only pillar around which the whole, the whole household works. And if she is away for reasons like a lump which is painless, it's growing all right, but it is not causing her any discomfort, she continues to do what she does. And if I were to say that if the educated ones also on a priority list, if you were to ask me also, you know, if you ask me, I would say that when my last mammogram was, say, about 8 years ago, which is such a shame considering that I am a breast surgeon, but that's the way we are, because
Headline.
Likewise?
I'm saying headline.
So, you know, that is how we are wired. And I think it is no great credit to us if we try to behave like superwomen every single day, and we think it is a great service to the society. But what we realize is that at the end of it, it is about you. And you've lost the plot by the time it comes to you. Because I say that in a priority list of 1 to 10, if I were to say number one priority, my child; number two priority, my mother-in-law; then my husband; and then my my work; then my colleagues; this, that, and the other. And I am 10th on the priority list. By the time I get to priority number 10, it is 11 in the night. And I just couldn't be bothered about what happens to priority. So that priority number 10 stays number 10. So I understand the stigma. So you just coming back to what you were saying. So this is the way things are. It has not got anything to do about your level of education. The stigma is there, but I see a lot of empowered women, and not just people on the forefront. I see a lot of people coming from lesser backgrounds also trying to be very vocal about their situation, trying to tell people, what they're dealing with. But it is also about the society. The society doesn't engage in that discussion. They are just curious. They just want, you are a piece of news to them. So I keep telling my patients, don't divulge this information to a lot of people, because they are counterproductive. Because we want you to be in a good, positive space. And most of these curious bystanders would be relating stories of how people didn't make it. I said, talk of those people who are by you, who really care for you, and going to tell you stories about.
Also talk about all the things that you can do. Ayurveda, homeopathy.
Yes.
It can cure cancer.
So we deal with it all the time, and I can assure you it is not a great space to be in. And the thing is, because of the kind of social media exposure we have, everyone is an expert. And it is the behavior of the human mind to accept what I want to hear. So if somebody says, standing on the podium, that, doing a biopsy is going to cause the cancer to spread. You do a mammogram, the cancer will spread. Not realizing the kind of harm that they're doing. So I am seeing a lot of patients who come with an MRI, who come with a PET CT, but they've not got a mammogram and a biopsy done.
Because we have been told by the society.
Yeah, so this is this person who sounds very convincing and talks with a lot of conviction that that's the wrong thing to do. Not realizing what kind of
And a
harm.
lot of followers.
Huge number of followers. So that is what I say. Social media is great so long as you are a responsible person on the media, because what I say on media has to be done with a sense of responsibility. I should not be sharing wrong information with people who go to the social media. So it's a lot of things.
I'll come
So
to you,
can I-
Vaishali.
Kalpana,
Yes.
just,
Yes, please.
So every day we see patients who don't want a biopsy to be done. The myth is if you touch the tumor, if you put in a needle, it will spread. So it's actually a huge, huge myth. Barring one or two cancers, you have to have a tissue diagnosis to declare that this patient has cancer. So I think this is an important platform, important message which should go from here, that biopsy is mandatory to diagnose cancer. No PET CT scan, no MRI, no mammography can diagnose or confirm the diagnosis.
I hope we are able to address this through this platform. And Vaishali, I'll come to you next. As the head of patient advocacy at Novartis, you obviously deal with a lot of patients. And what do you see as the biggest challenge, and how do you really support them?
So one of the principal philosophies at Novartis is that nothing for the patient without the patient. And I think that's something that we stick to very, very sincerely. So even this campaign, for example, the Take Charge is developed and co-created with the patients. So we've spoken to multiple patients, cross-section of the country, to really figure out what is that one actionable insight that is going to bring about a movement. Because it is not about just going and telling people, right, that you got to do something. It has to come through the language that they talk about. So most often, as being pharmaceutical companies, scientific in nature, we tend to use terminologies that the medical fraternity uses because we're so used to only working with the doctors. Just switch the cell and then just say that what is the conversation that the patient is actually having? What are the real fears of the patients? And I think we've heard enough that it is about the patient and the caregiver, the entire ecosystem that supports the patient, and what is that vocabulary? And that's when the patient is going to resonate with what we are trying to say. And Take Charge is one of those campaigns which we've said that, we will create with the patients so that people resonate. And what was really beautiful this morning was every single patient or a caregiver out over there did resonate with that two words, saying take charge. And it was just so beautiful to see how that insight has come into action and people were motivated to go out and make a difference. So I think that's the big difference. You've got to start and live the life of the patient and start thinking from their angle.
And that is where I think Anchal comes in.
Yes,
and
very much.
Yes. So how do you feel, Anchal, you can reach out to more people and, who are seeking help, because cancer somehow tends to be a very lonely journey about the patient and the caregiver. How do you feel, because there are forums, there are communities, but a lot of people tend to go in a shell, they don't want to talk about it, and they suffer in silence. So how do you feel we can bring about that change and help them take charge of their health and journey?
So Kalpana, in Canheal community, we are majorly focusing on that. We have many cancer patients and survivors. I'll give you a real story here. There is a lady called Priyanka. She's from Gurgaon, and she said, Anchal, post-cancer treatment, it's been 5 years. I feel like I'm not alive anymore. I don't know things about me. I don't know what I like. I don't know what I don't like, right? It took me, so when I got to know this, it took me 1 year to convince her, please come. If you don't like that meetup of Canheal, you can go back. Just come for 10 minutes. And she she is trying to escape. Oh, Anchal, I'm down with the fever and all of that thing. But that one push from our side, actually convince her. She came and she's now regular with all our meetups,
Lovely.
Next day she called me. There was a rain. She said, Anchal, you know what happened? I went to my roof. I take a shower in rain and feel alive again. So that is what we are trying to do. So small gaps where they feel, like I always say, we always address the numbers and the percentage of the survival and all of them, and then, other information. But sometime being a survivor or a cancer patient, I don't want to go there and I don't want to listen that thing again and again. Maybe that's the positive part, and that is very important for us to know about, new things, what is good for us, what all precaution we have to take, what all medicines are good for us. But still they said, I have gone through so much of pain. Now I need a place where I can spend some happy moments. So what we do, we call them every month. We just, do workshops like an art workshop, bike rallies. We do other workshop, dance workshop, something where they have fun and nobody is talking or addressing cancer. And we just tell them, come, have fun and go back.
That's so
Just
nice.
to add to what she said, and this morning when I was sitting through this meeting, what really came out was, are we reframing the conversations around cancer? Yeah. So one of the pieces that stuck to me was, we were just addressing everybody as cancer survivor, and they're saying, no, we're not cancer survivors. We are people who fought cancer and won, and we want to live a beautiful life. So the whole take charge comes from the fact that nobody wants to be labeled as a survivor, which is a level down, but, as a person who's like living life fully.
That's very interesting.
And that is also coming from a person who's dealing with the last stage cancer.
Yes. I think I'll rephrase everything and I'll keep this in mind. Do not address someone as cancer survivor, but actually they are fighters and they are emerging so strong, way stronger than all of us. Dr. Shyam, again, changing the narrative a bit.
Yeah.
We know cancer cases are growing. We know the age bracket that we would originally assume that, this is the age bracket that gets cancer. The age is coming down and all of that. But in your practice, have you seen, what kind of a role, it's a non-medicine question maybe, but what kind of a role does faith play in treatment?
Say that again.
Faith.
Right. Right. So I think it's very, very important. So we see patients day in and day out, and we regularly make this statement to our juniors, to our colleagues, and even to our patients. And that statement is that if a patient has full faith in the system and in the team of doctors who is treating, he or she, here it's most likely she in breast cancer, but then we treat all sorts of cancers. So they will get the best out of the team, and the best result only comes in if you have faith in your treating team and the doctors who are involved in their care. So there are patients, today social media, Google, etc., all is there. But then this is such a disease, when anybody gets it, and today's treatment has become so very expensive. When they come to us, we tell them, you're going to take this medicine, which is going to cost this much thousands and maybe 100,000 of rupees. So it's quite natural and normal to go and cross-check that the doctor is, giving you the correct advice. So we don't sort of challenge that, and we don't blame them. But ultimately, I think you have to have full faith in the system where you are getting the treatment from, and the team of doctors to get the best result for yourself and, of course, for your family. So I think faith is very, very critical.
That's very interesting because, you'd expect a doctor to just keep on telling you that, this is the treatment course and you will go through it. But, that sort of, to have faith in your treatment, obviously, like you said, it can work magic. Dr. Geeta, I would like to ask you, I heard somewhere that they say, and a young, I'll exactly quote it, that early stage, breast cancer in early stages is a good cancer. I didn't want to get it wrong. How do you explain this statement?
So, I get when I see patients, so there's a diagnosis and you see that it is a hormone sensitive tumor, it is HER2 negative. And I'll say कि आपके tumor का character अच्छा है. So, they will kind of wonder, what is this? आप क्या बोल रहे हो? Cancer तो cancer होता है, इसमें character कैसे अच्छा होता है? तो होता है ऐसा. So, it is not one disease. So, about 20 years ago, you would treat every breast cancer the same way. Things have changed so much. So much, and it is changing as we speak, because I do realize for a fact that in another 10 years, every single patient on a daycare bed would be having a completely different treatment for the same disease. If you're talking breast cancer, every bed would be having a different kind of individualized, personalized, precise treatment. So that is where we are. So, we see a lot of new molecules coming in every day, and I'm sure Novartis is also on the forefront of having developed these molecules and are in the process of developing more molecules. Of course, they're exorbitantly expensive. Lot of molecules are very expensive, but the narrative is changing around breast cancer. So if you call an early breast cancer, which is hormone sensitive, which is small, you can call it a good cancer to have.
Something that can be treated.
Yes, and the other thing that, because it is, you're there. So when I talk about advocacy, I think what is wrong with our advocacy is, so Anchal is an advocate, and you are also doing your piece. I'm doing my piece. I've got a foundation. I'm sure Dr. Shyam is also. The trouble is we are doing the same things in different pieces, but we are not collaborating. So if Novartis actually means to kind of get our voices amplified, to be heard in the corridors of power, and to your question about how mammograms can be done, because it's not going to happen. It's not happening. I can tell you that mammograms as a screening protocol is not going to happen in our country. At least I don't see it happening for the next 50 years. But having said that, this collaboration, you have to get all these foundations who are doing bits and pieces together on the same table, get them to understand what we're trying to address, and if you do not repeat the same thing and do different things, I think the impact is going to be much bigger, and your voices will certainly be heard where it needs to be heard.
Absolutely. You're making a very, very important point, and it's eventually when all the entire force comes together is where the momentum will happen. I mean, I fully agree with you on this.
Dr. Shyam, you want to add something?
No, I think we all need to sort of get together. And as I said in the beginning, we really need to have awareness programs. And to, as Dr. Geeta said, there's so much happening in the field of breast cancer, it is mind-boggling. When we started doing the treatment for breast cancer, we were talking about removing the breast. So now it's not happening, to that extent. Now people are talking about breast-conserving surgery. So which has become a major common theme, and actually women want it. So that is one change, which has happened, which we must convey, that even if you have breast cancer, it's not your breast is going to be removed all the time. So you can just have a portion of it removed, and the results are going to be the same. So the other paradigm shift which we need to tell women and people are that even with a tumor which is 2 centimeter, Dr. Geeta would have liked to operate all those tumors, maybe 10 years ago. We want to operate, but then the role of chemotherapy and the role of targeted therapy has come up in such a big way that unless you do the biopsy, characterize the tumor, you should not be doing that, because a 2 centimeter tumor should not be operated today, should be given chemotherapy and then operated after 4 or 5 months. So there is a sea change happening, as Dr. Geeta said, in the evolution of treatment for cancers. So today we are talking of next generation sequencing, because the tumors are governed by genetic aberrations. They are not inherited. 95% of the times women acquire those changes in their breast cell genes which result into cancer. Now we have the ability to pick up those genetic aberrations and target them, not only from the tissue but also from the peripheral blood, because the tumors are shedding those abnormal DNA mutations in the blood. You just do a blood test, and within 15 days you get to know this is the target, and you can target. You're not talking of chemo, you're talking of targeted medicines. There's so much happening in this area, and in the next 5-10 years, as Dr. Geeta said, so we are going to do these liquid biopsies or looking at the gene aberrations in the blood, because the tumor is shedding the DNA mutations in the blood, and you will, have personalized precision therapy for each individual. So I think we need to really spread these words, not only for breast cancer, it's going to happen in every cancer.
That's very interesting, and keeping the time in mind, I would like all of you to give me one message for women suffering from breast cancer. What is that one message you'd like to give them?
So I have, because these are the platform we don't get very often, so I want to take the opportunity here. One message is not for every cancer patient or a survivor. Here I want to give for a society. Please think what I said before. Please try to create some opportunities for these female who don't have a family, who are single mothers, or who are still need support financially and medically. If you can create a small jobs for them, it can be really a very big help, and everyone we can help at least in their basic survivals.
Would anyone else want to?
Yeah, I think it's about I would say one thing, trust your doctor. The doctor is the best person to take decisions for you. And I think that's the most critical piece, in addition to asking the right questions and getting all the information, but no substitute to the doctor.
So I would say that, we keep talking awareness and all that, but what I want to say is that women should, great idea to take charge of your life, and please exercise your power of choice. Nobody should be making the choice for yourself, because I see a lot of patients, small 1 centimeter tumor, amenable to conservation, has a mastectomy done because her husband, her son, her neighbor all wanted to be a mastectomy. So I think, and the woman doesn't want it, but she doesn't exercise the power of choice, because I think that is the way it is for her. But I would encourage each one of you, if you know anybody who has a problem like this, that she should exercise her power of choice.
Yeah, I think breast cancer, if detected early, is curable. It can be eradicated, and person can lead a normal life and should be positive, number one. If somebody is detected in advanced stage, people are living for years together, decades, so there's nothing to fear. It's become a chronic disease like diabetes, hypertension, and heart disease. So it's not that everything is over if you have a diagnosis of cancer. You still have a lot of life, and it all depends on Anchal, Vaishali, and all of us to make their life more fruitful and active. Thank you.
Just another thing, and that is, please try and normalize breast cancer.
Yes.
Don't make a hula-baloo around it and make the person think that,
Yeah, because I'm living more than happy life than anyone else maybe been through a cancer.
And you are shining the most today. Can't call it tonight yet. Thank you so much for joining us. Thank you.
A huge round of applause once more. And can we have Pooja Sethi back on stage to please felicitate each of our panelists, the token of our appreciation. Thank you for sharing such a rich range of insights from your personal and professional anecdotes alike. Let's have you please remain on stage with us. And Kalpana, if you could kindly do the honors and present each of our panelists with a token. Such powerful, real human stories, ladies and gentlemen. Yes, keep the applause coming. The tales of bravery and emotion. All right. Thank you once again, Ms. Sharma, Ms. Iyer, Dr. Geeta, and Dr. Shyam. Adding a lot of weight